Candida is one of the different types of fungi that live on and in our body. Candida is usually found in a very small amount in the intestine and mouth and even on the skin. When at normal levels, this fungus may not cause any symptoms. However, once Candida begins to grow in an uncontrollable manner, it can cause a severe infective condition called Candidiasis. Let us learn more about Candidiasis with respect to why it occurs, its common symptoms, and treatments. You're also going to want to stay until the end to find out about the special diet aimed at eliminating this infection. Candida is one of the most common causes of fungal infection in humans. Usually, the healthy bacteria in our body are able to keep these fungi under control by preventing them from multiplying. However, once the healthy strains of bacteria are disrupted due to a poor gut flora, or when the immune system becomes weak and compromised, these fungi get an opportunity to overproduce, and as such, one may develop Candidiasis. Here are a few factors that are known to cause Candida overgrowth. Eating foods high in sugars, especially refined carbs such as pastries, chocolates, and ice creams. Excessive use of antibiotics. Diabetes. Increased alcohol intake. A weakened immune system due to the long-term use of steroidal drugs. Long-term use of oral contraceptives. Severe mental stress. One, oral thrush. When Candidiasis develops in the mouth and throat, it is called thrush. It is a common sign of Candidiasis in adults as well as newborns and those with a weak immune system. Oral thrush becomes evident in the form of bumpy, white patches that appear on the inner cheeks, tongue, tonsils, gums, and throat. The lesions are often painful and tend to bleed when scraped. People with poor oral hygiene and removable dentures can also develop oral thrush, as these factors create a favorable environment for fungi to grow. 2. Recurring urinary or genital infections. Candida can infect the urinary tract in both men and women, and the vaginal tract in women, resulting in symptoms like redness, swelling, and itching of the parts. Women may experience painful intercourse with a white and thick discharge from the vagina. The symptoms of urinary tract infection due to Candida in men and women include burning sensation while passing urine, frequent urge to urinate, foul-smelling urine, and pressure or pain in the lower abdomen. 3. Digestive troubles. The overgrowth of Candida is often associated with disruptions in digestive functions. It may put you at risk of developing inflammatory bowel diseases like ulcerative colitis or Crohn's disease. 4. Skin infections. Just like in our gut, there are bacteria on our skin too. These bacteria help to prevent fungi like Candida from growing uncontrollably. These bacteria thrive in conditions related to moisture, temperature, and acidity levels. A change in these environmental conditions can affect the healthy bacteria on your skin, rendering them ineffective at controlling the overgrowth of Candida. For example, excessive use of cosmetics, moisturizers, and soaps can alter the moisture and acidity levels of the skin. This can make you prone to develop Candidiasis. Similarly, you're also likely to develop this infection in the parts of the skin that are moist and warm, like the armpits and the groin. Redness, itching, and rashes are the common symptoms of fungal infections of the skin. The overgrowth of Candida may also lead to conditions like ringworm, athlete's foot, and toenail fungus. Though these symptoms are not life-threatening, fungal infections of the skin can cause severe discomfort and even embarrassment, thus affecting the quality of your life. 5. Excessive weakness. It is common for patients with candidiasis to experience extreme weakness and fatigue. Candida can affect your energy levels by contributing to nutritional deficiencies, specifically of vitamin B6, magnesium, and essential fatty acids. It is particularly the deficiency of magnesium that has been believed to cause weakness and fatigue. Also, Candida infections usually occur when the immune system has become weak. The low-functioning immune system itself might leave you feeling fatigued and tired. However, it is difficult to diagnose candidiasis based only on these symptoms, as weakness is a common sign of almost all diseases. Hence, it must be correlated with other symptoms like thrush before the diagnosis of Candida infection is confirmed. The most effective way to treat candidiasis and prevent this infection from recurring is to identify and address the underlying causes. If you have a tendency to develop candidiasis recurrently, there is a need to pay attention to the foods you eat, the cosmetics or soaps you use, and your personal hygiene. Here are some tips recommended for the treatment and prevention of candidiasis. If you suffer from severe acute symptoms of candidiasis, your doctor may advise you to use topical antifungal ointments. Apply a small amount of the ointment on the affected parts as recommended to relieve the symptoms and clear the infection. Reduce your intake of refined sugars and high lactose dairy products, as these foods can encourage the overgrowth of Candida and other bad bacteria and fungi. Increase your intake of vitamin C foods like oranges to strengthen your immunity. Consider using vitamin C supplements if your immune system is very weak. Maintain optimum personal hygiene. Brush your teeth and clean your tongue at least 2 times a day. Keep your armpits and groin regions clean and dry. Avoid using antibiotics unless advised by your physician. A Candida diet includes foods that can help to fight fungal infections, improve your immunity, and enhance gut flora, thus protecting you against the repeated attacks of candidiasis. Here are some foods that one should include in their Candida diet to prevent this infection. 1. Citrus fruits like oranges, grapes, or pomegranate, as they provide a rich natural source of vitamin C that can boost your immunity and help your body fight infections. 2. Probiotics like yogurt and kombucha tea, which can enhance gut flora and support immune system functions. 3. Garlic, as it can produce an antibacterial and antifungal effect and reduce the risk of infections. 4. Turmeric. Turmeric possesses natural anti-inflammatory and antioxidant properties, which helps to minimize damage to healthy tissues. 5. Coconut oil. Coconut oil can be used for topical application to relieve itching. 6. Aloe vera juice. Aloe vera juice can be used for topical application during the recovery phase to support faster healing and restore natural smoothness of your skin. Modifying your diet, maintaining personal hygiene, and improving your immunity will help you avoid Candida infection. You can also follow a Candida diet to get rid of symptoms of candidiasis in a shorter duration of time and prevent recurrence in the future. As usual, if you like the content of this video, I ask that you subscribe to my channel, share the content with others, and click on the bell icon to get notified of new videos whenever I create them. I hope this was informative enough. If you have any suggestions or things to add, comment down below and share it with us. Your input is always welcome. So until then, see you in the next video.